Hello, and welcome to the Mimosa Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to Mimosa Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a Mimosa Matters poster chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's podcast. We will be hearing from Professor Robert Snyder, who's a visiting professor at Cardiff University School of Medicine in Cardiff, in Wales, in the UK. He is a past president of the Association for the Advancement of Wound Care and the past president of the American Board of Wound Management. Rob is a very familiar face in our wound care world. Welcome, Rob.
Hi, Doug. Thank you. Thanks very much for having me.
Let me start our conversation by asking you a few questions about your poster entitled Imaging-Informed Debridement, a case series on multimodal quality measures in chronic wound care, such that our listeners can get some insight into your experience with NIRS imaging. Tell our listeners a little bit about your clinical practice and experience.
So for the past 35 years, my practice has been limited to wound management and limb preservation and limb salvage. For the past 5 years, my practice really was more focused on clinical research, which is really the secondary endpoint that this study of the poster actually discussed.
Great. Give our listeners some background into the study featured in your recent poster at the SAWC Fall Conference.
So basically, this was an investigational endpoint for a study that we were doing based on a new cell and tissue-based product. And what we wanted to see was whether or not debridement had an effect on vascularity. Of course, wound debridement has always been looked at as the cornerstone of managing chronic wounds by removing necrotic tissue and bacterial burden, etc. But also, my strong feeling is that debridement will actually signal the body to create the movement of growth factors and other substrates which are required for healing. But up until now, the only way we really had to evaluate this was visual evaluation. Even angiography did not really show us a great deal about the small vessel vascularity, particularly in patients with diabetes. So this new technology now that we have, the Mimosa device, has really been a game changer for us because it gives us an opportunity to quantify the amount of circulation on a micro level that is seen at the wound site, also looking at thermography, and also very importantly, getting a visual image of the wound itself so that you can see whether or not the wound is improving.
Great, thanks. And what was the outcome of your study?
So the outcome really showed that debridement certainly had a positive effect on vascularity. And of course, this happened depending on the wound itself. In some cases, we had a very profound effect, as high as 17%, in other cases, 5%. We also found that even at the very beginning, even before debridement, if we went ahead and did an image pre-debridement, and we did pre and post debridement images, we found that with pre-debridement, we could make a very, very good assessment as to whether or not the patient had a local ischemic process going on at the wound site. And of course, this would have a profound effect on whether or not the wound would heal.
Thank you. And how did NIRS imaging help with this study?
Well, I think it helps us as a predictive device. It allows us to make some decisions early on as to whether or not we feel the wound will heal, whether or not we feel that any therapy, whether it be an advanced therapy or just standard care, would really have any meaningful response based on the patient's vascularity. Obviously, you can't heal a block of wood. You need to have vascularity. Another thing to keep in mind is wound bed preparation. One of the hallmarks of wound bed preparation is the formation of very robust granulation tissue. Certainly, vascularity plays a very important role in this process. So we can find out very early on, and of course, as we continue to debride and see whether or not debridement alone or in conjunction with some other therapies is going to actually change the paradigm and make it more easily healable, certainly is extraordinarily important. This, to me, as I mentioned, is truly a game changer because it takes the guesswork out of the vascularity issue. Again, prior to this, all we had was observation. And now with the possibility of using NIRS and thermography, we have a very, very good chance of having some predictive value as to whether or not the wound is even healable. And of course, in the wound bed preparation model, the first portion of that is the wound healable at all? And I think this can give us a very, very good idea as to whether or not that is feasible.
Great, thanks. And why is a 10% change meaningful? And what's the need for structured, statistically significant data in the management of wounds?
So really, very, very often we look at the 10% change in the microcirculation as a very, very good parameter. It's often considered clinically meaningful because even small differences in oxygenation or perfusion certainly can reflect substantial changes in the wound tissue viability. And of course, the converse is also true. A 10% reduction may clearly signal ischemia and impending tissue breakdown. So this really becomes extraordinarily important. Obviously, we need a good deal of literature. It needs to be structured, statistically significant data. It has to be formulated. But for now, I really think that 10% is a very good benchmark as far as whether or not we feel that wound will go on to heal.
Great, thanks. And how important is the size of the device and its portability within your practice?
The size of the device is really critical. It's the size of a cell phone. Basically, it's very, very easy to use. It's easy to hold in your hand. Patients are not afraid of the device, which very, very often, you bring a big machine in and patients start to become concerned. You can keep this in your pocket. You can move around with it. You can take it on the hospital floor. You can take it to the clinic or really anywhere. And it gives us a very, very good idea of exactly what we're dealing with from a small vessel vascular disease perspective.
So size does matter.
Size does actually matter in this case.
Last question. What is the key message of the poster that you would like to share with your clinical colleagues?
So the key message really is that we have to really embrace these new technologies, and this multimodal imaging of not only NIRS but thermography really offers an objective, real-time data that really enhances the assessment as to whether or not debridement would be beneficial because we're going to see differences in percentages, but also even on the front end. When you do the initial evaluation, it's going to be very, very evident as to whether or not the patient has appropriate vascularity, particularly from a micro level, in order to heal this wound. And of course, this has, in my view, the most relevance in patients with diabetes.
Fantastic. Well, thank you, Rob.
Well, I appreciate your time and thanks for allowing me to share this poster with your audience and have a great day.
Thank you, Professor Snyder, for giving our listeners an in-depth insight into NIRS imaging and its utility in clinical practice. Well, that's our Poster Chat podcast for today. We hope you've gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit Mimosa Diagnostics at www.mimosadiagnostics.com and visit our social media channels. Add your comments and learnings. We want to hear from you.